Good day, and it's an absolute pleasure to welcome you to the Brimstone Investment Corporation and Groote Schuur Cancer Dialogue. I am Kieno Kammies, and it's not about me. It's about our esteemed panel today. We're going to be unpacking cervical cancer. It's something that more of us should talk about, and more of us should play a role in when it comes to supporting, etc., etc. But we'll get on with the conversation. I'm going to get our guests to introduce themselves briefly. We'll start with Dr. Tracey Sheridan Adams.
Thank you, Kieno. I'm Tracey Sheridan Adams. I'm a gynaecologist, which means I'm a gynecologist who's trained to work and care for women with gynae cancers and do the surgery thereof.
Okay, brilliant.
I'm Celeste Dennison. I'm a qualified sound engineer and also a leader, pastor in our church that we head up, myself and my wife.
You left out amazing husband, but okay.
Amazing husband.
Hi, I'm Celeste Dennison. This is my husband, and I'm an educator by profession, and yeah, I just love children.
And I want to thank all of you for actually being here today to share your story, and I think this will really help a lot of other people out there, which is one of the reasons why we're doing it.
Thank you. I'm Sharonne, Dirk. I am a 2IC, second in charge, manager for a debt review call center in Cape Town called National Debt Advisors.
We should do a whole new show on that one, I think. And then, of course,
I'm Dr. Aqeela Sirkhotte. I've recently qualified as a clinical radiation oncologist at Groote Schuur Hospital, and I'm finishing my registrar training now at 31st of December of this year.
right, so you fit all of that into a business card, right? My question is, what exactly do you do? I mean, what is it? Yeah, just a bit of an insight.
We work in conjunction with Dr. Adams, so we treat patients with cancer, with chemotherapy, as well as with radiation therapy.
Okay, brilliant. So once again, it's an honor for me to be here. We're going to be telling stories, and I think that's the most important thing about today. It's a storytelling platform that will emotionally engage other people and hopefully drive change, acceptance, and all sorts of other stuff. But I think painting the picture is always a very good one. So let's start with you, Tracey. And I think it's probably better to ask the question why it's so important to be focusing on cervical cancer.
So I think that's really important, and I thank you for the opportunity, because I think we need to realize that women have many different kinds of cancers, but specifically cervical cancer is our biggest problem. It's not only a problem in South Africa, but globally. If you look at the 2020 global can figures, there are more than about 600,000 new cases diagnosed every year. And in South Africa in 2020, we had about 10,000 new cases diagnosed. Now, we need to recognize that breast cancer is the #1 cancer in South Africa. There are about 15,000 cases, but the difference is that despite there being 15,000 new cases of breast cancer, of those breast cancer women, 30% will die. As opposed to cervical cancer, of the 10,000, about 60% will die. So in the world globally, every 2 minutes, there was a woman dying of cervical cancer. And cervical cancer is preventable, and therein lies our problem.
Okay, but I think the question, my follow-up question to that would be why? Is it because people don't speak about it, leave it too late? Is it the nature of the cancer? Why is it that the numbers are so high?
I think of cervical cancer, I always say it's the shy cancer. We don't speak about discharges. Women don't speak about their symptoms, either because they're shy or because they're too busy looking after everyone else. Breast cancer is very important. I'm not saying it's not, but it is easier, it's more spoken about, it's on the media. You never hear about cervical cancer. You never hear the radio chatting about it. So that's why I'm so grateful for this opportunity.
And I definitely think it's something that needs to change because, I mean, with acceptance, and I just want to bring some men into this for 2 seconds. You know, depression. Men never talk about depression. Boys don't talk about those sort of things. It's a load of nonsense, man.
Absolutely.
The more you talk about it, the more people realize they're not alone, the more acceptance you find, you get, and yeah, anyway, I'm very happy that you've raised that.
If I may add something, that I think there's also a big stigma about what causes cervical cancer,
Right.
that we maybe need to chat about a little bit later.
Sure.
But I think what we need to recognize why so many women are dying from cervical cancer is because when they present with advanced disease. So if you look at our Groote Schuur figures, we see about 300 new patients every year with cervical cancer, 280 to about 300. But of those, only about 30 to 40 I'm able to operate on per year, which means the majority, we can only operate on stage 1 disease, so the majority present with advanced disease, which can be treated, but not with surgery.
And as a doctor, how do you feel, when you know that something, how does it affect you?
I think you evolve as a doctor. So
Mhm.
in the beginning, you're wanting to do, operate, treat, and with time, you get to start advocating.
Yes.
Because you realize that every little step is important, and you can't always depend on government or policy. You need to play your role.
Indeed. Thank you very much for that, Tracey. Aqeela, would you like to pick up on that and add any extra points from your side?
I just wanted to touch on, I think we'll go through management and going through a lot more detail a little later. But I think when Tracey talks about advocating, I think prevention and screening, and that's how, because cervical cancer is treatable. It's one of the most treatable cancers we can treat. But often because it's picked up so late, it becomes advanced and it's harder to treat, and your rates of curing the cancer become less. I think something I also wanted to add that Tracey had mentioned, as you mature and as you evolve, you realize that there's always something we can do for our patients. And that's something that we need to look at, whether it's preventative screening, whether it's treating patients where we can cure them, or when we aren't able to cure, in order to give them good palliation, good pain control, quality of life. That is also something that we need to look at.
Thank you very much. Now, I want to move on to our survivor stories. And what I'm going to ask, and if you're comfortable with it, so I'm just really appreciative that you are here today. And we'll start with you, Sharonne. Let's talk about that moment you found out, you got your diagnosis, and take me through the journey.
First of all, I thought I was going to die. It felt like I'm done. And the only thing that kept me going at that point was my 3 beautiful daughters.
How old are they?
17. One just turned 10 and the other one is 8. She'll be 9 next year. Yeah, so it was quite traumatizing because the company I'm working for at this moment, I worked for the same company about 4 years ago. And when I was diagnosed, I worked for them. So it literally happened in the toilet at work. I went to the toilet, someone told me, look, you're looking pale in your face, something's not right. I went to go wash my face. I went into the toilet, locked the door, and that's the last thing I remember. I fell apparently, knocked my head in the toilet, doors locked, they couldn't get me out, and they just said, just a stream of red stuff coming out. So they rushed me to the hospital, and I literally was told, after they did some checkups and things, where's your partner? We need to speak to you. I think I knew they already. But there's this thing called Dr. Google, and so I was with Dr. Google on, and I think I think I knew because I had an abnormal, flow and period and things, and I just thought, okay, it could be stress, and once again Dr. Google told me it's stress and everything going on. I'm in a very busy working environment and fast-paced. So when I found out, and it was actually a doctor at Somerset Hospital, I think I was kind of prepared because I think I kind of knew. But it only hit me when I needed to start the treatment, and that is where it actually hit me. Because then I was hospitalized. It was every day in hospital. I was getting weak. My body was giving in. The chemo was just making me more ill. And I was very positive because I thought, this is what they told me. This is what's going to happen, and it's going to help me, and I'm going to survive this. And the journey with the hospital itself was wonderful because they really made me feel like I can beat this. So I think that's what also kept me going. But it's the worst news ever.
Yeah. And how important, and I don't know because I don't know the full story, right? So dealing with this, 3 amazing daughters, you thinking to yourself, you know, I want to be here for them, I don't want to leave them, what's going to happen, all those things go through your mind. What got you through it emotionally?
So I lost my dad before that. I think that's what also, hit me. I can do it. My kids are young. I'm a single parent. I was at the time. And they look up to me. They're the only thing I have. I spoke about it earlier to the guys off set, and I said that I think what broke me was that I had to spend Christmas and New Year's in hospital. And I think that's what made me realize that I can't spend any more time here. I need to go home to my kids. But it was wonderful because one Christmas I actually got to go home and spend with them and come back. But I think that's what made it worse was my baby. She's 8 now. She was only 5 at the time. And she needed me. And I think that's what just told me you need to beat this. And I think what mentally broke me down was that my body was fighting it, but my mind was not fighting it. I was like, I don't know. I don't think that I'm ever going to survive this because I'm just getting all sick and sick. And as a doctor said earlier on, it could be the fact that you either shy, you don't speak about it, or you don't know, and that's why it progresses so fast. I think it was the fact that I knew something was wrong, but I just thought it's probably just a normal thing.
Sure.
I'm probably just bleeding long, whatever the case might be. So I also think it was just I was in denial.
How important is a support network?
Very.
And you had a good
Yes.
support network? Not only in hospital, because I pick
No.
up with Somerset, of course, you got some really good treatment there.
Yes.
And down the line.
At
which is
Groote Schuur, yes.
Schuur as well, yeah.
But I still have a very strong support system. My family, my partner, my parents, my mom, my siblings, and work. So specifically the company I worked for, I was actually, because of me, they actually had a little sick bay at work because I would come to hospital. So they would open like at 6:30 in the morning. I'd make sure I'm there. Dr. Faki, which was my doctor at the time, would make sure that I'm early there so I know I get help first.
Wow.
And it's government, so people complain, you sit all day. You must come early. It's not free. You must come very early. So I'll make sure I'm there early in the morning. I get my treatment, 2 days radiation, 2 days chemo. I know it used to swap around. And I would go back to work from that. So after having chemotherapy, I would go back to the office because I'm a single mom, so I need to work for my kids.
Yeah.
But I told myself, if I keep me busy, because if I'm going to be at home, they go, oh, you're okay. I didn't want to feel that way. I didn't want anybody to pity me. I'm going to do this. I'm going to beat this. So my work, completely supportive at the time, which I'm back at that same company today. But yes, support is, you need that. Funny enough, the person having cancer, I don't know if you feel the same way, Celeste, they are more weaker. Your family's like, they a wreck. And you the strong one, and you supposed to be the one that's all out. But you the most strongest one. I think that's also what helped me. I was worried more how do they feel? How do you feel today?
And my final question is that of paradigm shifts. I remember I was in hospital with COVID, and I really thought I was going to die. The stuff up my nose. There are a couple of people who can tell you about that. And it was a huge paradigm shift in me personally, and the way I see life, and also the way I see illness. Was there any paradigm shift in you? If so, what?
Yes, complete. As a person, I've changed so much. A mother, I could not possibly say I was the best mother to my kids, but I've realized I was given a second chance, and not just with that, I've become a better person. I've recently, about 2 years ago, started an MPO with about a few good friends of mine, where we just give back to the community. So I think this was I was given an opportunity to go out and do something great, to be greater, and it really helped me. So I believe that you would not be put in a situation that you cannot overcome, and I'm grateful in a way for what actually happened to me. I believe it happened for a reason.
Sharonne, thank you very much for sharing that story.
Thank you.
It takes a lot of courage, eh? It really does, and I really appreciate that. And let's chat about your journey, Celeste. Same thing. Let's talk about when you found out. We'll talk about your amazing husband as well. He was there for you, but you'll tell us the story.
Yeah, my story is quite the opposite of Sharonne. I started, like she said, women always notice there's a difference in your body. But it's not. It's the matter of you're either too busy to take note of yourself because you're worried about others, and you're so aware something is wrong, but yet you ignore it. So I went for a normal hospital visit for high blood, get my medication, and just by chance, at the normal hospital, by chance, I just happened to bring this question forward. My period's irregular, what can I do about it? And just there, the doctor or the nurse asked me a question, when last have you gone for a pap smear? Now, those things also, it's like falls down the wayside. It's not always asked. The women, they're not clued up about it, how often you need to go. And then I thought to myself, I'm married 16 years. I've actually never gone for a pap smear. And then she immediately made an appointment. When the results came back and it said abnormality. Like Sharonne said, you go to Dr. Google. So now I wasn't concerned at the time, but I was curious to know. Being a teacher, so obviously you want to know, do some background checks. And then they said there's all the different possibilities that it could be, but I have to send to Victoria. They did exactly the same thing, and Victoria confirmed through biopsies that it is cancerous. But what amazes me, or what I was amazed when I received the results, now normally, like Sharonne said, fear comes over you. There wasn't a shred of doubt or fear that came over me. I looked at the doctor, and so I said, are you sure, doctor? Okay, so what's the next step? I'm going to trust your judgment now. I'm going to trust your call. You obviously know better. So I'm not going to jump to the next conclusion or jump to the worst case scenario. Take me through it. Explain to me what's the next case. But I must say, when my husband Morgan when he came in, and I explained to the doctor again, can you just explain that same news to Morgan? And he bawled in tears. So men obviously receive it differently. I'm not going to say I'm the stronger one. I think that's just because my faith carried me all the time. I'm a Christian as well, faith-believing Christian. So I believe that God obviously is going to be with me all the time. He's our healer, so my faith was quite strong. So I remember going through, Grootske called me to come sit around, I call it the round table, Nights of the Round Table. So with all the specialists are there, so now they're going to take you through. And I remember Dr. Tracey was the one that spoke the most, because I remember your face. But it was good information. And I mentioned something about, what about internal radiation? And then she looked at me, she's like, I can see you an educator. Because there's not much patients that know about internal radiation.
Yes.
So yeah, I've gone through the internal, external, but that's the essence of how I found out.
You got kids?
No, we don't have any kids.
It's actually, I mean, it's people get it affected differently. I mean, you obviously, and you talk about strength, right? I believe strength is relative. And I actually like the fact that men can cry.
Yeah.
Number one, I always encourage men to cry. I think it's amazing.
I chunked.
Yeah, no, absolutely. And the thing is, yeah. So let's talk about you. I mean, you found out about this, you bawled your eyes out. And let's talk about the support, because, I mean, I mentioned to Sharonne earlier that, I mean, a support network is essential.
Yeah.
Your pillar is sitting right next to you. So maybe just a little bit of insight, because I'm sure he doesn't want to pat himself on the back. So, no, but just to tell me a little bit about the support that you received, and then I'd like your take on that as well.
Literally from the second we found out the news, he was 100% with me in body, in spirit, in mind. He was with me when we went every hospital visit. He sat there patiently. Our character is quite loud, and we love people, so we use the time to encourage people, because that's what we do for a living. We're all leaders in our ministry, so we're constantly talking to. And my experience, I could see especially the younger girls that were there. You were totally confused. When I was like 3 or 4 weeks through the process of treatment, I could share my experience with them. I could ask them questions. What are you feeling? What are you going through? Don't be shy to ask the doctor. This is what they do for a living. It's their life. They love what they do.
Right.
So be open and ask them. And obviously, he spoke to the guys, kept them entertained and things like that. I have a strong support system of my church, my family, my extended friends, my work. Oh my gosh,
Yeah.
my work colleagues were phenomenal in supporting. They made sure that I get paid every month while being at home, so
Yeah.
that was awesome.
Oh, wow. Oh, that's great.
But I love the fact that I have a supportive husband that was with me. We had sad stories at the hospital to hear how, sadly, how husbands leave their wives through this process. Now, imagine you a wife, just hearing the news alone.
Yeah.
It's sad. It's really sad. You have to walk this journey yourself alone, and then you still need to worry if these kids, worry with kids, and now you obviously don't have a husband.
Absolutely. Well,
So-
let's talk about from your perspective now.
Yeah, let me tell you, speaking about faith and actually need to have faith, it's two different things when you actually have to live it.
Yeah.
And it's easy to encourage people to have faith, but when you actually require it, it's a total different story. And cancer is a foreign word in my family. We don't know cancer, and what society is painting about cancer is death, and that's the first thing I thought.
Yeah.
And when you hear your wife, the one you gave your life to and stuff, and me being a survivor of COVID, I was gone, and the way she supported me, I was prepared to go, you know, and I just survived COVID. I just came out of COVID,
Yeah.
and then bam,
This hit.
this hit, and you first thing you think your wife is gonna die. Oh my goodness, you know, and that's why I couldn't believe it. That men, and it just shows you where our society is lying mentally. That men will leave their wives. The question comes up: did they ever love their wives? And that's a touchy thing. So my first response was emotional. I didn't have any faith. I had nothing. I was emotional because it's my wife, right? And immediately when going to the car, I just sat in the car after that news while she was with the doctors. I didn't want to be there. And this old, I don't want to call her old, but she was a very good doctor. She's like, no. Good, positive thoughts. She's telling me this. She's encouraging me. My wife's got the cancer. She's telling me, no positive thoughts. And immediately I thought about what she was saying. And I thought, you need to start thinking positive
Yes.
and start being positive. Besides being a pastor, you need to be now a positive person, because the first thing she don't need is negativity.
Yeah.
And I believe that's a very vital, and just then immediately I changed my attitude. Immediately I told my family, listen, no negative stuff, no talking about blah, blah, blah. I gave them that news, right? Because the first thing that when people find out news about someone else, they want to give advice. And it's normally the bad advice. So I told her, leave Dr. Google out. You trust the process and you trust the doctors. I believe someone that knows. I'm a sound engineer. I'm a producer. So when clients come to me, they put their faith in I'm going to give them a quality product.
Yeah.
Because I'm the qualified one. That's why they come to you. So I believe that these beautiful ladies here, they know what they're talking about. They didn't go just suck it out of their thumb. They didn't buy the doctorate over the internet.
Yeah.
So we believe that process. And it's amazing when you follow advice. Our Dr. Dalby that was dealing with us, he used to tell us, do this, do X, do Y. And we did X, Y, and Z. You know, so.
Yeah.
And a lot of people, because I want to get on to some of the other things that we spoke about, and I think causes and all that sort of stuff I think is important for us to get out there as well. But I can't reiterate this more. The service you get in the public health care system. There's this myth that it's nonsense, that, you know, only doctors who can't get into the private healthcare system work. That's a lot of rubbish. As a matter of fact, if you look at the doctors that are in the public healthcare system, a lot of them are in the private healthcare system as well, working their arlies off to try and, you know, assist everybody. So just a summation of your experience in the public healthcare system from both of you very briefly, and then we'll move on to...
Yeah, my experience first from, if you talk about healthcare, I'm starting from the day hospital. It was, if this doctor, if she didn't love what she did, she wouldn't have suggested the pap smear. Because that's what you do. You love what you do, so you go the extra mile. And then from there, it went to Victoria. So Victoria also has a stigma on a thing about Victoria that they call it, you die at the hospital. So sadly, that's been said. But I had exceptional help. It was brilliant. They were... I mean, you have to, like I said, it's all about the, if I had my family member come in, and I'm a doctor, and the way I treat my family member, that's how I would treat the next patient.
Yeah.
That's exactly how all the doctors were. And then I went to Groote Schuur and exactly the same. It just carried on and it just got better. The radiologists, oh my gosh, we became so close.
Yeah.
I mean, I remember there was one of the doctors, she was pregnant, and I started calling her pregnant fairy. I mean, it's like a network of family that you build up. So that was lovely. I had a great experience. There was one shade of negativity or anything bad about
And you
it.
get free tea, so it's nice.
You know, that is the nice thing about.
Yeah.
Anyway.
I got my tea regularly. When I came in, I knew already. Want your tea, 2 sugar right there.
Tracey, let's move on, and I think it was good getting the personal stories because you need to connect with journey and you need to see yourself potentially in other people and how they dealt with it, and I think you've added quite valuably. Thank you very much. But I think getting back to basics, you alluded to this earlier. Let's talk about the causes and let's talk a little bit about, you know, all the things around that we spoke about earlier.
So I think the way I see cervical cancer is that it's a cancer caused by a virus, which it is,
Yeah.
the human papilloma virus. I think there's a lot of misinformation about how we get this virus. Many people will say it's sexually transmitted, and that is one of the reasons for the stigma.
Yeah.
Okay, so I don't see it as a sexually transmitted because 80% of us will be exposed to the virus.
Sure.
That can't mean that we all have STIs.
Yeah.
Okay. It is not the human papilloma virus on its own that causes cancer because most of us will clear the virus. 80% of us clear it. In a small percentage of men and women, you don't clear it. So it is the persistence of that virus, once it goes into the cells and changes the cells, that causes cancer. And it doesn't only cause cervical cancer, it causes other kinds of cancer in the oropharynx, penile cancer, vulval cancer, but it is more commonly in the cervix. So it's very important for us to understand and to change the narrative that it's a virus that causes the cancer, because if we understand that, we can treat it, we can prevent it.
Okay, talk a little bit more about prevention, right? From, I mean, obviously it has to be a personal perspective.
Yeah.
So if you can give
So
us
there
more
are two
details.
kinds of prevention. We refer to it as primary and secondary prevention. And secondary is what Celeste alluded to with pap smears. So a pap smear is not actually meant to pick up cancer. It's meant to pick up pre-cancerous cells. So in women, you're supposed to be getting pap smears from, it depends where you're living, but essentially from age 25 to 30 upwards. And the aim of that is in someone who does not have symptoms. So you are not bleeding irregularly, you are just going for screening to pick up precancerous cells. Because if we pick up the precancerous cells, we can do an intervention, meaning we remove those cells and so prevent cancer. So that's secondary prevention. Then we have primary prevention, which is my little narrative that I want to. It's about HPV vaccination.
Yes.
And so that is a vaccination to prevent you actually getting the virus.
Okay.
Yes. And that vaccination is available in this country. It is available to, so the idea is to get that virus to young girls. I mean, you could vaccinate boys as well.
Sure.
In terms of being gender neutral. However, in South Africa, that vaccine is available to 9-year-old girls only in public schools. 9-year-old grade 4. There's a lot of controversy, and the reason I say the school-going vaccination problem is good, it happens, but I mean it's not available to private schools because the thought is that if you could pay for a private school, you could pay for your own vaccination. But once again, you're saying, wow, you probably don't know about it. There's not a lot of media, there's nothing in the newspapers about it. And so a lot of parents, they receive a letter where they have to sign permission, but they may not be getting enough information
Yes.
about what they are preventing. Because if we could get that out more, those kids who are not able to get it in the school section, parents could get it elsewhere. It's a 2-dose vaccine, not in 6 months apart.
Can I add on to
Of course you
something
can.
with
This is it's a dialogue. Anybody can pop in.
So being in the school environment, I've experienced that with the parents. So when I spoke to the doctor that was there or the nurse, and I spoke to my case and my treatment, and he was shocked and he said, oh my gosh, you're the perfect person to speak to the parents. So I obviously know most of the parents, and when I actually spoke to the parents, and more parents came on board and started filling out the forms for the young girls, the 9-year-old girls.
I mean, in this year, we also need to remember there's been a lot of mistrust created with the COVID
Yeah.
vaccination. So
Yeah.
I know in the beginning of this year, there were certain protests in certain areas in Cape Town against the HPV
Yeah.
vaccination. So the more we can get our girls vaccinated, and hopefully at some point in time our boys as well,
Wow.
we can eliminate, not prevent, eliminate cervical cancer in that
Wow.
cohort.
You know, I think one of the
Amazing.
biggest enemies to doing this is the media itself,
Yeah.
because the media gives air to, and I say this because I've worked in it for almost 3 decades, it gives air to some of these other views that people then buy into, not based on any fact, but stuff that people pick up on Facebook and Dr. Google
Yes.
and all the rest of it. And they also don't give enough airtime to, you know, what we're doing here today,
Yeah.
which is and media should be about fact. And I'm happy to say it. I've been in the industry. I've seen people try and chase clicks and headlines, and that sort of nonsense should really, really stop. So I think from a solutions perspective, one needs to find a way of actually getting that message out there more effectively. And there are alternative media that one can use.
Okay.
This is one of those alternative media sources that we're talking about. Aqeela, from your side, you know, a lot of people think that when they get cervical cancer, things need to, you know, you immediately need to cut out, you know, parts of the body in order to save people. That is not true. So maybe you can give us some insights into that.
Sure. I think there is the idea when patients Dr. Google that they feel to be cured, you need to have an operation.
Yeah.
And Tracey can vouch for that often. So I just want to touch base and say in our institution, we have what we call a combined clinic. So we have the gynaecology team and then the clinical radiation oncology team. And together we make a management decision of what is best suited for the patient, depending on the stage of their cancer. And I think we pride ourselves of practicing standard of care. So whether you're being treated at Groote Schuur or whether you're being treated at a private hospital, we are doing what standard of care is for cervical cancer at Groote Schuur Hospital. So we sit together, and you can vouch for us sitting at our combined clinic and then deciding on the management best suited for the patient. And often we have the questions, but doctor, why am I not having an operation? I want it cut out. So with cervical cancer, as Tracey had mentioned, if it's not very early, an operation is not possible. But we can cure patients with what we call definitive chemo plus radiotherapy. So that's sort of more the medical jargon. And I think I want to touch base, as we mentioned with Tracey, is to let the community also know what radiation is. Because we often find that we struggle to get patients to accept or want to accept that form of treatment because they feel an operation would be better. No, my neighbor said that I would get burnt. It's going to be very painful. Will I be able to hold my baby if I'm getting the internal radiation? Those are all sort of misnomers that we have to discuss within the community of what radiation is. And radiation is like an X-ray.
Yeah.
Our ladies can vouch for that. It's not, the actual treatment is not painful. The difference is that it's a very high dose of energy that's there targeted to the cancer in order to kill the cancer cells. And we give chemotherapy with the radiation therapy for cervical cancer patients because it makes the radiation work a lot better. So we call it a sensitizer to make the radiation work a lot better. And we at Groote Schuur are very fortunate. We've got a high dose rate brachytherapy suite that we've started, and we are able to give our patients 4 sessions of brachytherapy, which further improves our local control and cure for our cervical
What is
cancer.
brachytherapy? Sorry.
So brachytherapy is what she had mentioned, the internal radiation.
Okay.
So we insert transfer tubes into the mouth of the womb where we know our cancer is sitting. And that is how we give radiation, so it will, for a limited amount of time, it's about seven minutes, and it gets taken out. So they are not radioactive to their partners, they are not radioactive, they can hold children because it's not within the body. It is high dose rate given
Directed in.
during a particular time, removed, and the patient goes home on the same day. 7 minutes of treatment.
I wanted to add something. I think people don't know what happens behind the scenes. So Aqeela's alluded to the fact that we work in a multidisciplinary team, which we do. You see radiation oncology and you see gynae oncology. We operate, they give radiation, we
Yeah.
decide together, we look at people, not only their stage, but the performance status, how fit they are to tolerate different forms. Remember, cancer can be treated in 3 ways: surgery, chemotherapy, or radiation. But behind the scenes with radiation, there are also physicists who plan your treatment.
That's
So
right.
they're sitting, so when you would have heard about a markup, when you get marked up, so I don't know
Yeah.
if you want to explain that a little bit
Yes.
more,
Yes.
what exactly happens.
So we do a markup scan. So we try and limit the dose to all your normal tissues because we've got normal tissue that does not have cancer, and we want to protect that from the long-term side effects of radiotherapy. So we do a scan so that we can plan the radiation therapy to limit the dose to normal tissue and to target the cancer. So we've got radiotherapy staff that will plan the treatment, but initially the doctors, so the clinical and radiation oncology team will draw the volume, so outlining where the tumor is, where we want the dose, how much dose we want there, and assigning priorities to ensure that we are limiting the dose to the normal tissue surrounding the cancer. Then we have a physicist that will have to verify that what we are planning is truly what our machine is going to give. So there's a lot of quality assurance that goes through behind the scenes, as Tracey is saying, to ensure that what we are planning and what we've simulated with this scan is truly what the patient will be getting on the day of treatment. So there's a lot of checks and balances that have to go through to ensure that quality assurance is always maintained throughout the process.
So I'm hearing about all this multidisciplinary approaches, etc. I wouldn't know, but it certainly seems like best practice. The question, though, is this what happens in each and every case when cervical cancer is treated in South Africa?
Very good question, very challenging to answer. It is what should happen. I think we are blessed in South Africa. There are parts of Africa where there are no radiation machines. So if you don't have radiation, you don't have access to treatment. I think the majority of radiation machines in Africa are, and correct me if I'm wrong, are in South Africa and Egypt. So there are countries where if you came in with an advanced or locally advanced cervical cancer,
Right.
it would be a death sentence. Hence the number of 1 in 2 minutes every woman dies.
Yes.
I think in South Africa per se, in the private sector, you would obviously have oncology units where you'd be referred to, so the checks and balances are there. Most people would have a multidisciplinary team. If not in the setting that we have, they would have discussions behind
Sure.
or together. So I think we're doing quite well, but I must say that challenges are more in the rural areas because there may not be the infrastructure. So we have a lot of women who travel from the Eastern Cape to get care with us, or Zimbabwe. We often have Malawians, am I right? So it depends on where. If there's no access to care, people come for care.
What about rural South Africa in particular?
Rural South Africa, the Eastern Cape is a big problem. So I mentioned earlier that cervical cancer is number 2
Yes.
in women in South Africa, but in the Eastern Cape it's number 1.
Oh, wow.
It's higher than breast cancer. So the numbers are great because the Eastern Cape has got so many rural areas and so far apart.
Yes.
So screening doesn't happen. Women very rarely get an opportunity to see a healthcare worker. And our oncology in the state sector, definitely, I'm not talking about private, but in the
Yes.
state sector in the Eastern Cape, the oncology services are concentrated in East London and PE.
And I mean, I work in the tech space. I have to ask this question, right? We have double exponential growth in technology, right? And that is, I mean, if anybody understands what double exponential is, it goes like this. So I find it very difficult to understand why we cannot use some of these technologies and almost automate it in rural areas with the help of corporates And because the bottom line is, right, I mean, if you want to be selfish as a corporate, if you want people to buy your stuff, they need to be alive. And just, you know, in terms of having a social conscience I mean, we can go down this route. Let's get back to my question about technology, though. Things like artificial intelligence, etc. I mean, are you aware of anything in that direction that might be looking at cervical cancer to help fight, you know, what you've just outlined?
If I may, I'm not aware of any, but I'd like to give you a spin on what changed my mindset.
Sure.
COVID. Okay, so if you ask any of these women, you never had a pap smear,
Yeah.
16 years of marriage. There's a policy in South Africa, in state, like most women in private will go get a pap every year, every 3
Sure.
years, because they go for their checkups. But state, you should be having, the policy is a pap smear every 10 years, from age 30, 40, 50, which sounds quite far apart.
It does, yeah.
Okay, however, most women are not getting those pap smears. Why? No one tells them. They don't know. Yet in COVID, we were able to get SMSs, you are due for your COVID vaccination.
So there we go,
Updates.
simple use of technology.
Technology. It can be done.
Yeah. And I mean, let's look at the numbers on this continent, right? If you look, I mean, if you look at the amount of young people, you're talking about dealing with the younger population as well. In Africa, we've got 650 million people under the age of 17. 60% of the population on this continent is under the age of, I think, 25. But if you look at men versus women, where it comes to having a cell phone, there's an average of 80% of people who've got access to these phones. Right. And I'm talking about AI and machine learning and all this nonsense. Simple WhatsApp or whatever it is, SMS,
Follow up.
follow
Here
up.
is your results.
Yeah.
Can be done.
But why not? Is it a lack of leadership? Do people not know about it? Everybody's got a cell phone. You know what it's capable of.
I think more conversations like these are necessary.
Yeah.
Remember, we
Awareness,
may
yeah.
sit with the information, but we don't have the background like you have about AI or business minds. I think more breaking of silos,
Yeah.
more conversations between business, industry, doctors, and
Schools.
brainstorming is a great idea. Because
Great.
we don't have those thought processes about how to, I may have the thought, but how do I initiate it?
Yeah.
How do I
Okay.
get it going?
So I will chat to the Brimstone Investment Corporation and some of the other people that I know, and I think, you know, we're having great conversations right now, but the question is, how do we actually land this and try and find those solutions?
Implementation science.
Implementation, right. So how do you actually do that, which I think is absolutely essential. And I love the fact that you speak about the obvious stuff that people should be, because low cost base, low everything, it's easy to roll out, and all you need is will. And I'm surprised at health authorities. I mean, when you get faced with as you say, they call it a black swan event, I call it a black rhino event. Made a lot of things extinct. And when you're faced with that, you now come up with all of these solutions.
Yes.
But it came about as a result of not just the health department sitting with it, Business Leadership South Africa, everybody else coming around the table going, okay, if we're going to make our way out of this, we better start talking. And I think we need to drive more of that.
More creativity.
Exactly, right. And that's not just with messaging people, it's also with the way we communicate. Finding platforms in which to land some of the information. Storytelling instead of lecturing,
That's correct.
which I think is...
Yeah.
So any other comments on that? Let's just open this up and talk.
I mean, okay, sorry, you go.
For me, being in the entertainment industry, movies, music is what people listen to. Create awareness in that sense. If we can do it with AIDS, we can do it with all the other type of diseases. I mean, I was part of stuff like that already.
Yeah.
So they can do exactly the same thing with this awareness. We'll create it like that. There's a doctor now. I think he works at Groote Schuur. He's actually on TikTok. But he going making songs or telling people about stuff, and he's getting a lot of attention.
I like this.
You know,
A
because-
Dr. Tracey TikTok account. A Dr. Aqeela TikTok account. Why not? Huh? Here we go. Sharonne, you've been listening to all of this. What's your
I'm
take?
in on it. I definitely agree. I just think that it's not much spoken about, and coming up with ideas, because I'm not only the specific doctor that you're speaking about, but I've also seen it. I think just the fact that we can do this. There's not a lot of people out there that believe, and if they hear it coming from people that actually survived it,
Yeah.
there's more hope. And prior to today, I've also, had the opportunity to do quite a few events where a good uncle of mine, Fugard Patel, he would host this cancer events within the Western Cape, and I would always attend, and he'd ask me to speak about it. And it helps because you never know how much people that suffer from. I think when I found out I had womb cancer or cervical cancer, I thought I was the only person that ever had it because I never knew anyone else. But there was so much people coming to the hospital, and I would sit with a room full of people, and I'm like, what you here for? No, we all here for the same thing. We're sitting in the same ward. I'm like, okay, so how long? It was amazing because I thought it was only me. But having the opportunity to do this, and I think I started a Facebook page called The Struggle is Part of the Story. I kept it for a few months, and then my life got occupied and things. But it was amazing while I was doing it because so much people would react to it and seeing the photos I would upload and how I look now. And doctor told me earlier on, you look amazing. And I felt so oh my word, it feels so good because I looked terrible 2 years ago. But the fact that I can speak about it and I can show, I think it's something good. Yeah. I think that TikTok thing is actually a good idea.
Yeah, we laugh at TikTok, right? But I mean, if you, and it doesn't have to be TikTok. It could be Instagram. It
Anything.
could be any other. Because this is where you've got to get the messages where people are, right? So people don't read newspapers. There's some newspapers nobody reads. We won't go into that. But people don't read newspapers. People listen to radio, and the people you want to capture in terms of attention, they're spending their time online.
Yeah.
So your messaging needs to be online. It needs to be emotionally engaging. It needs to be on point. It's not something that you necessarily know how to do, but it goes back to this discussion we had earlier about a multidisciplinary approach, but in communication as well. It's one thing to have a clinical approach. It's another thing to go, okay, we need to get these messages out. So maybe we find a couple of doctors who actually wouldn't mind being on TikTok. Maybe you're scared about it, but you know what? That journey where you go, we do one TikTok a week, just about it, right? And you work with someone who can help you put together, if it has to be choreographed, whatever, you get someone to help you start creating awareness around it. Now, all of a sudden, because you're doing a TikTok, you're not just seen as a doctor. You're seen as a other cool human being who's at my level, right? And I can now accept the messaging that you send, that you give me, especially with younger. I mean, I don't know many older people who are going to want to sit on TikTok.
You'll
be surprised.
Okay. So I get into trouble with sitting on TikTok, but I love TikTok. But I think it's going to take a paradigm shift from everybody to be able to achieve that. So Tracey, the one thing we did not talk about, symptoms.
Okay, so symptoms really depend on stage of the cancer. So some women can be completely asymptomatic, completely, and that is because it's a very small focus, and that will be picked up with a pap smear. That may be abnormal, and then we do a procedure and find the cancer. As cervical cancer grows contiguously, what that means is it spreads locally.
Right.
So symptoms depend on that. If it's confined to the cervix, most of the symptoms will be bleeding with intimacy, with sex, or offensive discharge. Okay. Some women, obviously, who are menopausal will then present with bleeding when they shouldn't be bleeding, or an irregular cycle, in addition to bleeding with sex. And as the cancer spreads more and more, you may get pain. And obviously, at the stage, if it's spread to the lungs or anywhere else, those symptoms will depend where the cancer is. But in general, any abnormal bleeding, any discharge that does not disappear should be investigated.
And then one of my final questions is prevalence based on age categories. Is there something like that? If so,
More or less. So we used to always be taught that when we were registrars that it was 50-year-olds and older, but it's more biphasic in that you've got an older population, 50 and above,
Right.
and then you get a younger population, 20, 30. But I think we need to remember that what gets written in the book is often very different because we often may be describing a screened population, you know. So whereas our country is not screened often,
Yeah.
women don't get their pap smears often. So we can get a 70-year-old with a cervical cancer. We can get, I've seen 28-year-olds, which are unusual, but that does happen.
Okay. And I think to wrap things up today, I'd like to leave it on a positive note because it's not doom and gloom. You've got doctors such as yourselves working really hard and you've been saving lives, right? So I would just like some of the positive lessons that you've learned through doing what you've done, and I'll work just as we're sitting at the moment, right? You've got insights, positive insights. I'd like to hear about it from a survivor's perspective and then from a doctor's perspective as well. But let's start with you, Tracey. See, I mean, let's end off with you and then we'll work our way around.
Positive, as I said, we can eliminate cervical cancer
Yeah.
if there's a little bit of political will, bit of community engagement, screening, and HPV vaccination.
Yeah.
We can eradicate cervical cancer.
Okay, great.
Well, what I've learned is that cancer is not a death sentence. It took years to get to that stage, and it can be prevented because the urgency for us to get treatment, I thought it was like we have to be there now. Doctor explained to us that it took years for the cancer to get to that size. So it's not something that's going to spread rapidly now that we found out. So the positive thing is it's not a death sentence, it can be treated, and you can beat it with a positive attitude.
I like that.
Yeah, my in closing is the doctors know what they are doing. Don't be afraid to ask questions. You know, one of the nice things about Groote Schuur, if I can speak about Groote Schuur, even if you are unemployed and you know that you need to have treatment every day for, let's argument sake, 7 weeks, there's a social worker that you can speak to. They can work out an arrangement where there's transport available for you. So don't panic that you don't have money. Then there's another after your treatment where they can refer you to a sex therapist. Because you're busy with your cervical cancer, so there's certain things that happen to your woman's body, so they refer you. So it doesn't stop by the treatment. There is help afterwards as well. So ladies mustn't be afraid and be shy about. Yes, it's your personal thing that happens, but you know what? Go through it.
There's
Face
support.
it, fight it, and stay positive all the time.
Really beautiful. Thank you for that.
Thank you.
Sharonne?
I, first of all, on a positive note to leave it, I'm just so grateful for my whole journey when I'm starting from Somerset Hospital, all the way from them transferring me through to Groote Schuur. I think the doctors don't get this or hear this enough, but I'm truly grateful, and I thank the Lord for having to be a part of the journey and with you guys specifically. Going back to the markup, that whole process, because you're mentioning, Celeste, that people won't understand, but why am I only going next month? It's a process.
Yeah.
They need to understand that what they're going to put me through is the right step for me to, survive this journey. And it took 11 months. But look at me today, and I'm really grateful for that. I don't think that I would have done it without you guys, and listening, that really helps if you just, do what you need to do. From up until today, I'm in remission for 18 months.
Wow.
And I get follow-up phone calls. I believe my doctors know on maternity leave, but I get follow-up phone calls. How are you doing? COVID? Are you okay? Because I believe COVID was like a huge thing with cancer patients and things.
Yeah.
But I'm truly grateful, and I highly recommend, besides sitting there needing to pay your 75 and admin fee, that's fine for me. But the journey was amazing. So if you're heading off to Groote Schuur Hospital, God forbid, because unfortunately you were diagnosed with cancer. I wouldn't even say unfortunate. it's the best hospital that you're going to. So I just want to thank you guys from the bottom of my heart. I truly, truly appreciate everything that you've done for me. Thank you.
Thank you so much, Sharonne. Aqeela, from your side, closing things.
I think I just want to reiterate what Tracey is saying and what we've mentioned, that we need to start the education, and it starts within the schools so that we can educate our young girls, educating them on symptoms, educating the community on that there is treatment out there, and that if an operation is not possible, radiation can cure cancer. And that it's not going to burn, it's not going to hurt you. And those are things that we need to get out to the community, that people know that there are different types of ways of treating different cancers. So every cancer is treated differently.
I really want to thank all of you for taking time out of your personal lives to share, I think, some really important messaging here. It's not where it's going to end. And on that note, I would just like to thank the Brimstone Investment Corporation, Groote Schuur Hospital, for allowing us to have these dialogues looking specifically at cancer. So you've watched this. What you can do is take that URL and share it with your family and with your friends. This is how we get the message across. Thank you very much for joining us.